This is Dr. Robert Watkins, orthopedic spine surgeon to professional athletes and creator of the Back Doctor app.
Hi, everybody. Good evening. It's the Bob and Rob Show. Back at you again. You can't get rid of us. We're still coming at you. We got more information to tell you, more stuff to share. If you're into backs and necks and sports, that's what we got. That's what we talk about. First of all, I want to thank you guys for joining us, obviously. That's great. All the support and everybody pitching in and giving comments and the likes and follows and subscribes is just so much fun. It makes it great. Share it with your friends and family, especially anybody you know in back or neck pain or anybody who's in the healthcare field. I think it'd help them. We have a new business Facebook page called Dr. Robert Watkins, and so if you'll follow us and like us, we'd really appreciate it. We're going to have a lot more information on that, even on a daily basis. Any random thought we have about spine, we'll just put on there, and on the personal page, we'll try and keep it, more kids and vacations or whatever. If you could subscribe and like that, we'd really appreciate it. One other thing I want to mention is in the comments when we're done, I'm going to put a link to a video we made called 3 Secrets to the Back Pain World. Talks about how to navigate your way through the back pain world, have surgery, don't have surgery, how to avoid it, all this kind of stuff, and some of our offers to you for how we could potentially help you. So today's topic is on athletes, taking care of athletes and spine issues and how to get them back. We decided we're just going to do the lumbar spine, the lower backs, because next is a whole nother topic. We talk for an hour, so we're going to try and do this in 30 minutes.
Right.
I don't know if my dad's ever given a lecture in 30 minutes. That light's a little bright on you. Let me change this real quick.
Yeah, that's better.
That is better. That was shining in your face. We're the producer, by the way, and the editor, and the micromanager.
Yeah.
But it's so easy. You just push a button and let it go. So anyway, today's topic, we're going to do the lumbar spine. And, our background, my dad was the first spine surgeon taking care of athletes really in the country, or if not the world. He'll never tell you that, but I can say it. And currently we take care of the Dodgers, Rams, Kings, Clippers. We see the Lakers. We see everybody, pretty much, and soccer too. We take care of all the female athletes that are part of USC and professionals as well. And so we got a pretty good experience. And high school players. We see kids 15, 16 years old with stress fractures too. And we take care of 80, 90-year-olds who want to play golf or want to do triathlons and want to get back to their sport. So it's a full range of people with back issues. So today's topic is, Doc, when can I go back to play? When am I cleared to play? And it's something we get asked. We get some funny phone calls or emails. I'll get an email. Somebody will go, I had a disc surgery, a discectomy done 6 weeks ago. Can I go back to play yet? And I don't even know them. They're not even my patient. They're still emailing us. And so this, when can I go back to play? When can I practice? When can I do these things are huge. It's a fundamental part of taking care of athletes. And in training and in medical school, you don't learn any of that. There is no real textbooks on it and the guidelines to do it. Pretty much my dad just made it up with a lot of other people and a lot of help of great physical therapists. But, we standardize it. It's in our app, the Back Doctor app. The whole program of progression back to activities is all in there. It's all pretty self-explanatory. And so with after our intro, I'm going to let my dad pretty much take over here, and because this is his forte. Clearing athletes to return to sports. We review studies from all over the country in every sport for people all the time because people need help. When can you clear this person or not? And what do we do to go by that?
Yeah, I think, Rob, when you gave me 30 minutes, I didn't realize you were going to take 5. That's okay.
You should know me by now. How long's it been?
That's okay. But I've been asked this question so many times, and it's such a critical factor. And the question generally is, Doc, is he cleared? And we've had some unusual conversations where we've outlined an entire treatment method for a player, and somebody on the conference call will go, well, Doc, is he cleared? And so I think that requires a definition of cleared. What does that mean? And it means a lot of different things to different people. For us, it is a question of, is he able to start the rehab program? Well, after a back surgery, for example, we walk as much as you can from the minute of the surgery. So that, in essence, is the start of the rehab program. And we're going to cover several different medical conditions: spondylolysis and acute stress fracture, spondylolisthesis, disc herniation, disc injury, and post-operative treatment after a discectomy. These are the common things we're faced with. So, Doc, is he cleared? And the definition, if you will, of that means different things to different people. For example, can he play in a Major League Baseball game tomorrow? No. You know that, and I know that. But are we going to start him on sports-specific exercises? Can he swing the bat? Can he do his normal sports activity? Or is he going to start the rehabilitation program that we've designed to return him back to his sport? And it's more the last thing. We're going to start the rehab program. Now, this is an important question.
Let me intervene 1 second, because that's a huge distinction that, and my dad always falls back on that. It's not a yes or no answer. Are you cleared? Are you going to be cleared at 6 weeks or not? No, it's do the rehab. When can you start the rehab and go through the rehab determines what activities you can do. It's not a time point or a yes or no. It's no. If you've established this level of core strength, you can do certain activities in a progressive return.
Yeah. And players, for example, that have been injured and had sciatica and a weak leg, they want to know. Our program is designed to prove to them that they can do it. It also proves to the team. Teams vary at different levels. It's a very legal question sometimes. NFL, it's illegal. Is he cleared or not? In college, if you're cleared to play the sport, you keep your scholarship. If you're injured and not cleared and cannot play, you may get your scholarship anyway. So knowing whether someone's cleared or not is somewhat of a legal question. It's also a question of can he perform and what can he do. In terms of teams, I had a long time ago, Al Campanis was general manager of the Dodgers, and I had a great experience with him when he asked, when's this player going to return? And I said, well, if it goes this way, it'll be a week, that way 2 weeks, that 6 weeks. Let me interrupt you, Dr. Watkins. Let me explain my position. I'm the general manager of a Major League Baseball team. My job is to have 24 men ready to play every night. I don't care which 24. But I got to have 24. So if you'll just give me an estimate, I'll make my plans accordingly. I've had the Lakers trade for a guy who was in the morning paper before I even woke up when they had to trade for somebody because the guy was falling behind in our post-operative rehab program. So don't worry about the team. They'll make their plans. In terms of the other players, yeah, if you're the right guard, you want the right tackle to be able to play, physically be there for you. So it's an intricate question at times. So what we're going to do, we're going to approach it from the player's point of view. We want to prove to the player that he can play, and effectively without that horrible pain that he had to have the surgery for or that he was disabled for.
I might just mention we take care of a lot of professional athletes, and most of the teams in town are men teams, and so we refer to he, and he's got to do this. And like I said, we do take care of a lot of women too, especially for the college athletes and professional too. But but anyway,
that's correct.
Yeah, but mild divergence. But it's true. And one of the things about these time estimates, as a doctor, it's really hard. You don't want to be stuck. One of the worst things, especially when you're young, is you tend to be overly optimistic. You don't want to hurt anybody's feelings. This guy goes down, the starting pitcher of the team. How long is he going to be out? You got to look somebody in the face and say 3 months. People pass out. And so you tend to kind of go, well, maybe 4 weeks.
One example of that, Rob, is an acute stress fracture in your back. Yeah. I've learned time and time again, I say it's minimum 90 days from today.
Right. Everybody can relax. Let him just soak it in.
That's been proven true. And one of the very optimistic coaches that Pete Carroll, when his son got hurt, he said, oh, no, it's not going to be 90 days. He's tough. He can prove he can do it and everything. And then later it was said 90 days, like somebody said.
Yeah.
But it was kind of like, so we have these times to certain injuries.
Let me say this one thing about what I meant to say is about the underestimating. But if you underestimate the injury and you say it'll only be 4 weeks or something like that, well, then if it takes 8 weeks, everybody wants to know what went wrong. Did the player not do the rehab? Who failed?
Yeah.
So these time estimates are really important for the team and the general manager and the coaches to make decisions on player roster movements.
Yeah. For example,
you just got to be as accurate as possible and not be too worried about hurting people's feelings or too big of a shock or anything else.
Or making them think you're a better surgeon than the other guy that said 90 days.
Yes, some of our competition will say the guy will be back in 2 weeks, and we're telling them 3 months. Well, they'll go somewhere else, but you take that chance.
Yeah, you have to do it that way because it's just real important because, the trainer and the therapist and the people that are doing your rehab program, they're heart and souls in this.
Yeah.
A lot of times they work for the team. And if somebody doesn't make it back on time, everybody looks at that guy.
Yeah.
And
Stan Conte, who was at the Dodgers forever. Where is Stan? Are you out there?
Yeah.
He was great. He told me a reporter one time, circle the date. 6 weeks, circle the date. 6 weeks a day, a reporter called him. Hey, you said 6 weeks. Where is he? Stan, oh, man, somebody's paying attention.
So let's use the example of post-operative back patient or an acute disc herniation we're going to treat non-operatively. Number one is our core strengthening program. It's listed on the Back Doctor app. It's a 5-level balance and coordination endurance core program. So we have standard. It gives you a number. You become a number. You're a 3.2 or 2.5, and we know generally how many throws from what distance a Major League Baseball pitcher can make after a back surgery. We know, for example, when an NFL lineman can go to the weight room. He definitely has to do level 3 after back surgery before he should go to the weight room. So we use these, it's a numerical rating, it's a quantification. If you're going to control the rehab and prove to the player that he's safe for him to return to play and effective, that he'll be effective, quantification is the key. I'm a very qualitative guy. I've had some great professors that help me become more quantitative, but you need a number on that rehab program. We can't have 25 different therapists and trainers out there and call him up. How's he doing? He's doing good, Doc. I think he can pitch tomorrow. I mean, that only goes so far. So we want to try to quantify these things. So our core program is a balance and coordination endurance core program. It's not 25 times of this cute exercise here, isn't this difficult? No, it's 7 straight minutes of a dying bug exercise. And that's level 3. So we want to have a number associated with the core strengthening. It's because we want those muscles to fire. And the reason why do you do core strengthening? Why is it balance and coordination? We prove coordinated core strength in the Gate Laboratory with Jacqueline Perry and Frank Jobe and Major League starting pitchers. What muscles fire depending on where your hand is in space and where your release point is. Different muscles fire. We prove coordination. So we want a program that's not brute force. It's balance and coordination, and that fits in like golf, balance and coordination. That's the name of the game. So it's the same thing. We want a balance and coordination technique, and we want it numerical, we want it quantifiable. What does that do? This coordinated strength does 2 things. If you're going to throw something, you've got to generate a lot of torque. For example, if you're a defensive lineman, you're going to grab an offensive lineman and throw him and get around him. It's heavy weight, but it's the same thing. It's torsion. So to protect your back, it protects the joints in your back if you have coordinated core strength, and it allows you to do your job, produce the torque to do the sport that you need to do. So we need to have a numerical rating. This is what he's doing. We base a lot of his activities on what his numerical core strength rating is. So that's a critical factor in this thing. The second thing is you've got to be in shape. If you're not in shape when you go back to your sport, you lose your balance and coordination. You're not making a free throw in the last minute of the game because you're out of shape and you've lost your balance and coordination. Well, we don't want to know whether somebody's in shape based on their lousy performance. We'd like to be able to numerically prove that, and that's not easy. We're not hooking everybody up to the oxygen recirculating machine, stuff like that, but every sport has a way of knowing whether their people are in shape or not. An offensive lineman is different than a wide receiver. So there are different aerobic aspects, but you've got to be in shape when you go back or your back is at jeopardy. So we want that aerobic conditioning component. I recently talked to a crew coach who basically said that his players were coming back out of shape after their back injury. I said, well, how do you get them in shape? He said, well, we erg. Well, for me, erging is the sport, and that's the torsion on their back. So cross-training and getting them in shape, for an example like that, yeah, you may have to do a different type of thing, but they've got to be in shape before when they go back, or they're more vulnerable to injury.
Yeah, and I think a couple classic examples you've always pointed out to me that I think illustrate for people, like a pitcher. If your core gets fatigued, well, then you don't generate the power from your core. Then you start trying to catch up with your shoulder and your elbow, and you hurt your shoulder and elbow.
Yeah.
It's a classic example.
Yeah.
And so you got to protect your back. You got to generate all the power for every sport from your core, so it's vital for that. And the other one is the aerobic conditioning. You got to be in shape to be able to do the sport properly. It's not just are you cleared to play. It's, are you ready to step in and the team can count on you for the whole game?
Is your performance going to be there?
And they, they're dependent on you. So you can't just, you're cleared, your back's fine. No, are you ready for the demands that are needed?
And we've done that by increasing the intensity over a period of time, the endurance component of the core program, and aerobic conditioning. From the minute after your surgery, we tell you to walk as much as you can from the day of surgery. That walking wakes up your core muscles. Everybody's pelvis rotates. Walking is a key part of not only aerobic conditioning, but core strengthening from the very beginning. I think another thing we have to mention is weightlifting, because it's kind of the primary form of cross-training. Every sport has it now, every single sport. And we've had so many people from starting quarterbacks in the 90s, some very specific people that were injured in the weight room, to a girl softball player I saw in the office today. I was doing deadlifts and hurt my back. I mean, I've heard that story so many times.
I think it's 50% of the athletes I see hurt themselves in the weight room.
Yeah.
In any sport. Every sport lifts weights these days.
Yeah. And we recently, at our university that we take care of, had a player who hurt his back. He's an offensive tackle. I went to the strength conditioning people. I said, give me a number, man. I need some numbers on what this kid has to do in order to protect himself and protect the quarterback. I mean, we need numbers here. We can't just say he's doing pretty good.
And you can't say, well, don't squat or deadlift anymore, because you
got
to do that to play football.
When I first started this, I said, okay, no squats and deadlifts, and that's my edict. Until I found out through a survey that every professional team, 90% of professional teams, in the NFL, that's their workout. That's a key part of being able to play the sport. So now, for example, with this player we just had, there are 10 or 15 different ways that you can get increased strength in your legs and your hips and have that power and thrust protecting your back. So you've got to have a back-friendly weightlifting program to protect your athletes. It doesn't matter if they're playing volleyball, it doesn't crew, whatever it is. You've got to have a way to get strong without injuring your back and meet these standards. What does it take? What does a guy have to do? Now, I'm sure I've had professional athletes that come in, cornerbacks, that say, I haven't lifted in the last 5 years. So there are exceptions to the rule. But by and large, you've got to have a back-friendly, quantifiable weightlifting program. And also, we don't let you go to the weight room till you can do level 3, for example, in the NFL. So there are ways to protect your back through cross-training, through both the core program, being in shape, and the weight reduction.
And I'll just mention the 5. Program. You keep referring to level 3. There's 5 levels. 1 is the easiest. Then you get to 2. And 2 is pretty tough. Most people, I can barely do 2. 2 is solid. But when you do 2, we typically let you do non-impact aerobic, elliptical, bike, swim. Level 3, you can start to run, get the impact, the axial loading. You can start to do rotation, sport-specific exercises. Level 4, between a 3 and a 4, before you get back in the weight room. If you're at a 4, you can get back in the weight room. 3, you can start. And then level 4, practice with the team. Professional athletes, we want a level 5 before they go back. And those are hardcore. That's not easy to do.
Yeah.
But some people think they want to do it right away and get back and play tomorrow.
And if you look at when we want this athlete to be, what's at peak performance? What's the best way to keep from getting hurt when you go back? Be at the best shape you've ever been in your life. Be at peak performance in your sport. That's how you keep from getting hurt. And the thing that Rob mentioned about pitchers with bad back hurting their arm, this is real. In Boston, they did some photocinematography and other things. What happens if you've got a weak trunk, your arm gets behind. Your release point is high, and you don't control the ball as well. Well, it's the same thing. If you've had sciatica in your leg, even though we've operated on your back and we've got your back and you meet most of the standards, you're more vulnerable for an anterior cruciate injury if you've got a weak leg, even though it's not that weak, it's not too bad. And also, again, back to that thing about pain produces trunk weakness. No, it's not a matter. I had one NHL goalie one time. I saw him in the office. He'd herniated a disc, and we went through the whole scenario. I said, well, you've got to do level 3 before you can practice. I go through the whole scenario. He's sitting there looking at me. This is a typical hockey guy. He goes, Doc, what if I get down on the floor right now and do level 5? Can I play tonight?
And he was serious.
Oh, dead serious. Dead serious.
Right.
His name was Richter. Yeah, dead serious.
Right.
So it's kind of like, no, that's not the spirit of what we're talking about. We want to retrain these muscles so that they're working for you to protect your back and allow you to have the performance.
I'm going to mention one other thing. Our back programs, the level 1, you learn how to train the muscles to keep your spine in a neutral, pain-free position.
Yeah.
So it's not about doing 1,000 sit-ups where you're torquing through your back and hurting the back and stressing the discs and the joints. Neutral, pain-free. Learn how to lock that in. Then you work up to more balance and coordination and endurance while you've trained that to protect the spine, keep the stress off the spine.
When
it's
I first got
it.
this program, it was through Art White, Joel Saul, Jeff Saul, the guys up in the Bay Area. And also when I trained in England, the exercise ball was all used from Scandinavians for cerebral palsy kids, all kinds of things, for this concept of balance and coordination. Then I heard one of the big knee surgeons in the country had people walking balance beams to restore muscle function in their knees. So, and we developed it, we expanded it, we quantified it again through 5 levels. Robert put it on the app, and it's made it very user friendly. But it's kind of the same concept: is that we want to be able to train these muscles to protect your back. And that's really the key in many ways. Cross-training brings up a lot of different things. We don't emphasize stretching in our program. There's stretching exercises from static, passive. Not many ways to treat backs with that. But dynamic stretching, where you're doing what you're going to do in your performance before as a warm-up, that's a very logical, safe thing to do. So and each one of these positions are going to have different things to do. So when we get guys back, they're getting better, that we prove to the player that he can perform and do these things without his back pain, and he's able to meet these standards in the rehab program. And we do this with everybody. Like Rob said, there are guys that work their guts out for 40 years in Detroit and retired at Palm Springs. They want to play golf. And so we work the same way to try to allow people to have sports performance standards that they want to meet as best we can. That's our goal. If that's their goal, that's our goal.
What about some of the tricky parts of different sports? Like I just had it recently where they've done the rehab, they're looking pretty good. You want to have them start practicing, doing some drills with the team and wearing the equipment. But then, so are they cleared? Are they cleared to play? Are they cleared to practice with the team? There's different shades of gray in there, and different sports have different policies. It depends on the contracts. You may clear somebody to practice with a team and to wear some of the uniform. Well, that may mean they can get cut.
Well, that's when
versus different sports. Yeah,
that's when I call it the position coach.
Yeah,
the infamous position coach. But to me, it's a critical factor. The position coach, depending on it, may be the head coach in certain sports, but the position coach knows what it takes to be successful. If my player can't do these things, he's not going to be successful. Well, the player wants to be successful. One thing we found out through the years is the most motivated, dedicated person to return to the sport is a player.
Yeah.
We work with an NFL guy. He's only got so many times a year. He's only got so many years.
Yeah.
It's the same thing. So the players are tremendously motivated to return. They want to be effective. The right guard, right tackle thing. He can't be out there limping around and getting run over and exposing his partner to jeopardy there. So, but it's just like performance. You have to prove to yourself you can do it, prove to the team. Like a rehab assignment in Major League Baseball, they use them all the time.
Yeah.
Because they want to see him play. They want a shortstop see him play. He's got to bend, move, throw. Is he up to speed performance-wise? The position coach is what I call that. He's the one that's going to say, can he do it or not? He's going to tell the player the specific coaching things to get him back to peak performance after his injury. And the trainers, I mean, I take my hat off to all the trainers. I'm a liaison with the National Athletic Trainers Association from the Orthopedic Society. I mean, it's just a critical factor, the role these men and women play in returning someone to performance safely at a high performance level. They're the integral part of the thing.
Yeah.
The position coach fills in as well in that regard.
Yeah, that's a lot of fun, respecting each person's role. The general manager's job to do, the head coach, the position coach, the player, the agent, the trainers, the physical therapists. And it's one of the great parts of our job. I mean, you hear some of the movies and the stories in the books about how people are forced to play and all this kind of dark side of sports. In our experience, 95% of the time, everybody's on the same page. Everybody wants this person to be at optimal performance to get back to play, to have a healthy career and contribute.
Can't say that enough.
And it's such a great community of people all on the same page and highly motivated and great experts. And really appreciating, the position coach, they don't know anything about a disc injury, but they know their part.
I recently had a player, same thing. He said, all the trainer wanted me to do was to get ready to play and everything. I said, that's his job.
Right.
He's treating you. He's in there treating you. He treats you for 5 hours a day if he needs to.
Yeah.
But at the same time, no, everybody's on the same page. Return to performance is part of the thing. And Mr. Campanis, I use that as a joke, but I believe me, right now today, my experience has been more than we're going to make you play if you're injured. It's more, if you can't play, I'm very sorry for you, but we'll find someone who can. So it's more in that vein in terms of
They're getting a little more protective. They're getting a little more protective.
Oh, yeah. And for us,
our job is to protect the patient.
Oh, yeah.
We are their ultimate advocate.
Well, that's what Bob Curlin. I went to work at the Curlin Joe Clinic. Right out of the university, I was in charge of fractured spines, paralyzed people, everything. I went to work for Dr. Curlin. Number one, these players are your patient. It's a patient. And that's what I learned from him. Frank Jobe, I learned something else. If you don't know the rehab and can't control the rehab, don't do the surgery. Right out of his mouth. And so that's why we've been so interested in the rehabilitation of injury or surgery back to full performance. And we have found everybody to be on the same page. All the players, all of the schools, all of the trainers. Everybody, all the coaches, everybody's has been on the same page.
Yeah.
We want to do, and the players really want to play. And it's been a great experience. And so our job, if we prove to the player, if you can do all these things, then it's going to be safe for you to return. And the position coaches and the people at your position are going to make sure you can do these skills so you know it, they know it, the trainers know it, the healthcare providers know it, that you're ready. It's not just like some edict from high, cleared, not cleared. No, it's a whole process that we want to actively participate in helping to restore our patient to full function.
I'm going to mention one other thing about time estimation, because that's the hardest part of our job. Is a guy hurts his back, or a girl hurts their back, and 24 hours later they call us and they say, well, what's your estimate? How long are they going to be out? And the reality is it's either going to be 1 day or 3 months.
Yeah.
And we have no idea. When somebody first hurts their back, you have no idea how long it's going to take. Is this, and so trying to give time estimations, and one of my favorites is a general manager, a really smart guy that I respect a lot, and he said, you guys don't really know what you're doing in medicine, do you? This medicine's overrated. You guys don't really. And it's kind of like, welcome to our world. That's the truth. These are the facts that there is no way to predict.
But we've got a lot of experience, and I think our heart's in the right place. We want people to safely return to full function.
And I'm going to say one other thing. One of the benefits of doing research, Frank Jobe, you may be reminding me of that, of doing the research is we've published the data on microscopic discectomies in the lumbar spine in athletes, a disc herniation in your back, most common injury and surgery. And we published that data that showed we had about 100 professional athletes all together. 89% made it back to their sport after the surgery. The average return was 5 months. 50% were back playing at 3 months. And we published that data. And the great thing about that data is publishing it is now when somebody asks me, you're going to have back surgery, how long to be back? I say 5 months. And they go, what, 5 months? And I go, well, there's a 50% chance you'll be there at 3 months. But having the data helps everybody to make some estimations. And the other one is our neck fusions. We had about 25, the most ever reported in professional athletes, and 80% returned to play. The average was 9 months. Yeah. So now we got some criteria.
What we found in some of that data, too, was somebody has a bad neck injury and a neck fusion, they may not want to go back to play.
Right.
If
they're 34, then the phrase you always told me is if they say, well, what I really want to do is be able to play with my kids, that means it's over. That means they've paid their dues. They're done, and it's code language.
And rightly so.
Because they're not always going to admit. It's hard for them to admit.
Yeah, and I've had people like these temporary, we'll talk about next time, but cervical spine, but if somebody's temporarily paralyzed, and they're one of the top athletes in the world, man, that gets their attention. That's different. Guys who played with a broken ankle, broken wrist, broken all kinds of things, sick, everything else, they're temporarily paralyzed. No, that's different. And
and nerve pain is too.
Yeah,
it's one thing to have some back pain.
Right.
You got nerve pain shooting down your leg or your arm. That wakes people up. That scares them because they know that's like nothing they've ever had before, and they want to get rid of it.
Yeah, that's a key factor.
Yeah. So I'll summarize what we went over. Basically, we talked about the difference in the legality of what does cleared to play mean. Are you talking about, is it going to jeopardize someone's scholarship, their ability to play, to work? Are you cleared to practice? Are you cleared to do the sport? Are you cleared for the rehab to start? And so there's shades of gray. There's not always a yes or no answer. You got to know exactly what the situation is, and ultimately you better ask the patient and make sure they're on board and they're comfortable with doing it. And then we talked about our treatment program, the back stabilization program in the Back Doctor app, and quantifying it, going through it, tells us how strong is their core, therefore what activities can they do. Then integrating them back with the team and talking to the coaches and talking to the sport-specific trainers and the physical therapists and what do they have to do to train to get to the sport. That's one of the fun parts about our job. Hopefully our phase 2 of the app is going to be sport-specific exercises. Every single sport. What can you do for every single sport? You know, if we ever get time, we'll knock that one out. Maybe Bobby the Fifth or Tommy can work on that project and then get that thing done. And then, and so the last thing I just want to mention again about our new Facebook page, our business one, the Dr. Watkins. Please like and subscribe. We'll have some more spine stuff on there. Check out our video. It's going to be in the link, The Secrets to the Back Pain World, about non-operative care, when surgery is a possibility, and some of the offers we have, how we can potentially help you. And I hope that's been enjoyable. Leave some comments, and I appreciate you checking in. You got anything else you want to add to it?
I don't think so.
All right, great. All right, guys. Thanks a lot.
Thank you.
Good night.